administer medications. There's lots of different ways to do it, as you all know. Same with kids as it is with adults. Orally, there's a lot of different ways to do it. You can use a pacifier to give medications sometimes, where they'll just suck on that, and then some of them are specially made where you can open them, you put the medicine into the end and they just suck it out. I've done it in the nursery, like with just a bottle nipple, and you put a little milk in that nipple and have them suck on that, and then just kind of squeeze the medicine into that milk, and they'll drink it up that way. It's just so you're not giving them air through it, but you know what I mean, you can do it that way, and they usually take it pretty good. Don't laugh at me, Mary.
I was gonna say that's the reason why I have trust issues now.
Probably, yeah. You think it's milk, don't you? But no, it's nasty as a medicine. You can also just use the syringe and give it, but just make sure if you're giving a baby medicine with a syringe that you go between the cheek and gum on either side, kind of squeeze it into the side, not straight back to the mouth, because you choke them that way or gag them. And I don't just shoot the whole entire thing in there either, because if they're not liking it or what, they'll spit the whole thing. So I just kind of a little at a time, and try to get it in that way. If they're a little bit older, they can use these little spoon thingies, and actually, they can drink out of it that way. And just make sure when you're measuring your medicines, though, for your oral medication, that if you put it in a little medicine cup, put it on a flat surface so that you're getting an accurate measurement. And sometimes you can do it like with that, and then pull it up in the syringe, if you want to make sure you're getting, being completely accurate on that. As far as nose drops, can you all think of something important you'd want to do before you give nose drops?
Make sure the passageways are cleared out.
Right. If they're all snotted up, and you try to put something in their nose, it's not going anywhere. It's just going to be in their, not be able to get in where it's need to go. So you need to use a bulb syringe if you can't blow their nose. If they're old enough to blow it, of course, have them blow their nose and try to clear it out good. Also, when you're doing nose drops, you might want to roll something up to where you kind of prop the shoulders, and it kind of causes a little bit of a lean back, with their head, or kind of lean them over the side of the bed a little bit or something, so that you've got a good passage there. Because if you're trying to give it to them, they're sitting up and you put nose drops in there, it's just going to come right back out. So sometimes too, babies that are still taking a bottle, or kids that'll still suck a bottle and they're drinking that, it's good to give nose drops like when they're sucking the bottle, because they got to breathe through their nose. So you catch them when they're on their breathing part, and then kind of push that nose drops up in there, and then they'll suck it right up in there. So ear drops. So if you're going to give ear drops, how would you position the ear if they're older than 4?
Up and down.
Up and back. Yes. If they're 4 and over, up and back. One way I remember that is 4 and above, up and back. 4 and below, down and back. And it just straightens out that canal, and so that you can get the medicine where it needs to go. Same thing with it, you kind of want to position them to where they're kind of on their side, so that you can get to that ear, and leave them that way for about a minute or so after you've put them in there, so that they go where they need to go and stay. Because if you just barely put them in there, they go right back to raise it up, turn around, it's just going to drip right back out. You can use a cotton ball there too if you want to hold it in. Eye drops are the same as for adults. Usually with the ointment, if you're doing any kind of ointment, go from the inner surface out. Don't touch the actual eye with the ointment tip. But you all probably saw when they put the ointment in newborns' eyes. It's everything you can do, just get that eyeball open. You don't poke it, but I mean, you just get it as close as you can get it in there, and it smears around. And sometimes that's about as good as you can get, or the drops. You try to get them in there, position them as good as you can. IM injections, where would you position, or where would you put IM injections? Vastus lateralis. You can also use that vastus gluteal. I haven't seen that done in kids, but you still could, and especially I guess if they're an older child, you could do that. Or the deltoid, and you find your positions the same way that you would in an adult. Same thing with the leg. You do the thirds. Like a hand here and a hand at the top, and you're in that middle third towards the outer surface of the leg. Not completely on the side, in the front, but kind of towards the outside here, like right in here. With younger kids too, you'll want to kind of sometimes, especially if they're like newborns or smaller children, sometimes you have to pinch that muscle up. You kind of pinch that leg up till you get it in there. And the big key is stabilization again. Like, I know if any of you have worked much with kids or you've seen kids, you about have to lay on them. You have to do everything you can, get that leg straight. Pinch the knee, pinch the muscle up, inject it, and I usually put it in, like hold on to the needle and then push it in because that, you know, if you don't, they'll just wiggle around that needle's in there and it's like, another important thing about IM injections on babies and kids, have everything ready. Like, you can't go in unprepared or forget something and be like, oh, I don't have a Band-Aid, where's it at? You know, when you're standing here with it, like you gotta be ready and get it done and get it done quickly because they're feisty and they're taken away from you. So usually if I had 3 shots, I got all 3 lined up, I've got all my alcohol preps opened and ready, I've got my Band-Aids open and ready, and I'm ready. Enlist help if possible. Like if you've got a parent that will help, which is great if you've got a good, helpful parent, you know, that can kind of help hold their legs still or help get up on hold their hands or up at the top part or something to help you, because some of them, I mean, 6-month-olds are wild. You get them up about 2-year-old and they are really wild and strong. So, or enlist the help of another coworker if you need to, things like that. And I mean, I literally, like I said, when I say lay on them, you can about lay on them. Like I've had to lay across the top of their body and then like get a hold of that leg and just, you know, done like that. As good as you can do, you know. Be quick, use distraction as appropriate. Now some kids, like I've told you all about mine, they do real good. My children always did. All but one, she's just, but not the baby either. It's another one. But as far as like have them blowing out candles, you know, act like they're blowing out a candle, act like they're blowing up a balloon. Like I'd have them look at me and be like, let's act like we're blowing up a balloon. And they'll be like, but I mean, it's just like labor, like it works. I could talk them through it and they would do that and they get their mind on that a little bit more, and it did kind of get them, like they'd be done with it before they actually realized they could get escalated into a panic mode, you know what I mean? So that works for a lot of kids. Squeezing somebody's hand, you know, just talking to them about something else, you know, that they like or whatever. They do have those creams that you can use sometimes too. Some places have them, which is very helpful. Or that, like that anesthesia, like you can blow it on there. It's like a kind of thing, and it kind of like the air. Have you all seen those that numbs their skin or whatever? So some places have that. Or ice cubes work too. Let's see. I think that's it. Sub-Q injections, same as for an adult. Anybody have any questions about any of these, or anybody know what size gauge you would use for a child?
25 to 25.
22 to 25. Yep. What about the length of the needle?
5/8 and 1 inch.
5/8 to 1 inch. Right. And no more than a milliliter per injection site. Right. That's basically what you'll be checked off.